Well, Caleb, let's first talk about Rare Disease Week. And, how many are you dealing with on a daily basis when it comes to your patients? Is it all over the spectrum?
Yeah, it's really everything. And that's one of the things about rare diseases that make it so challenging is that there's so many different kinds. But what we've really tried to aim at with our Rare Disease Day work is looking at the things that are common among rare diseases and, the feelings, the experiences, and how we can really help and address those for the greater good.
And I mean, you obviously, work with these patients on a daily basis. And honestly, the families and the children are some of the strongest people I'm sure that you meet. And it's amazing to see how they can overcome and fight through this.
Yeah, I mean, sometimes we sit down with families and you feel like you're going to give them this information or this news that, is going to be devastating, and they process it, and families, turn and they say, all right, what are we going to do? And I think that's really the heart in Rare Disease Day is bringing those folks together, people that have been on the journey or further along, to really offer that hand to people that are just starting and to really work together to address the common issues that affect folks who have rare disease, of feeling alone, feeling hopeless, and wondering what tomorrow has to hold.
What does a normal day for you look like?
It's all over the place. One of the reasons that genetics is such an interesting field, we never really know what's going to walk into the office or into the clinic, and that was exactly how things went with Marley. Until I met her, we didn't even know that her disease existed, and now we, know that there are a handful of folks across the world who have the exact same thing.
That's amazing.
It's eye-opening. And we hear that you even have a rare disease named after you. What is that, and how does something like that happen?
Yeah, so that really all started with one patient and understanding what was wrong with her genetics, and then understanding sort of the biology behind it with our partnership with Michigan State, and then describing that in a medical journal, and then starting to get emails from families or from other physicians in Europe and in Central America saying, hey, I have a patient and they look exactly the same, or they've had a similar health journey. And I think what's been most rewarding is taking what we've done and worked on here in West Michigan and sharing that with others, other families and other healthcare professionals.
Yeah.
So what do you have planned for today and maybe in the rest of the week?
Yeah, we are super excited to kick off Rare Disease Day, but really a week this year, moving virtual. We have a keynote speaker starting today at 5 p.m., but the rest of the week our events will be at 7 p.m., followed by a morning symposium this Saturday. It's all available free online. Folks are welcome to attend some or all. We're really excited about providing a broad range of programming and information for patients and families and advocates and students and really anybody that's interested in rare disease.